Thanks for staying with us right here on Bernama. I'm Jared Ratnam, and welcome to another edition of The Nation. On The Nation today, we celebrate World Palliative Day 2019. Of course, the day itself was celebrated on or observed on the 12th of October, but I guess the whole month is going to be based on the celebration of World Palliative Day. And I have in the studio with me Dr. Lee Chi Chan, who's a pediatrician and also one of our heroes at HKL. With him, another hero, Tome Jun, we know her as June. She's a nurse, and Michael Tan, a secretary for the Malaysian Association of Pediatric Palliative Care, or MAPPC for short. Of course, in Malaysia, we're very good with all our acronyms. So we'll get to the acronym later. Yeah. Let's talk about World Palliative Day, and also we want to know about you guys being a hero. So before we started the show, we had an argument as to who is the hero here. You said she's the hero. He said you're the hero. So okay, you're the nurse. You do a lot of the work in the background. But do you think nurses are getting enough recognition today?
Well, for me, I guess.
Well, you're looking for a very safe answer. Come on, go for it.
Yeah. Of course, we never think it will be enough, but it's actually up to us to fight for more. Yeah, it depends on our own effort and courage. So, as a nurse, I always believe that we should push ourselves to actually do more for our patients. That's what most important. Yeah.
Right. Dr. Lee, do you think enough is being done for nurses? We're going to get to World Palliative Day. Stay with me on this one, yeah.
I think that's why I invite John to come together with us.
Right.
We really want to recognize their role. It's very important, especially when the nurses who work in the community, go to patients' home, driving how many meter to go to patient home.
Yes.
I found their job is really, really fantastic.
Right. No, but while we respect that doctors do amazing work, why do you think we don't understand yet how important the role of a nurse is? Michael?
I don't think so. We misunderstand that we don't appreciate what they're doing actually. But we feel that...
we appreciate, but we don't say lah.
Yeah, we don't say it out. And then I think, I'm not so sure, but perhaps Malaysians are always very, very reserved with our compliments, you know. But like, take me for example as a secretary for MAPPAC. I believe that I have my part to contribute as well. I'm a non-medical person, but from the perspective of a secretary, I'm able to contribute in the management, the administrative part of it. And to be able to say communicate, reach out to people who comes in the
so you are establishing the gaps that need to be addressed, and you are seeing where you can fill in with your experience. Now, World Palliative Day 2019. A lot of us, when we talk about palliative care, we talk about the elderly, those who are aged and who need help to leave this world, so to speak. I'm not going to use the word death. So when we talk about that, we always forget that children are also, we also have a section which is children that we never talk about. So where do we begin this conversation? Maybe we'll start with the most important person, June. Yeah.
Okay, so usually, because I'm actually from ASIS, Palliative Services, ASIS is actually an organization's, charitable organizations from Asunta Hospital, and we've put our focus on community care, community health care, mainly to help the patients, poor patients who can't really afford medical services, including the pediatric, kids who need palliative care as well. So that's mainly what I do, including my team as well. Yeah, so we have a doctor and a few more nurses together with me. So what we basically do is that we will go to our patient's place, home environment, and we render the palliative care in their home environment, because I believe and we can see there are actually a lot of parents and their kids that prefer to spend their time in home, actually at home, rather than in the hospital. So basically, when we go to the house, we have to see what are the things that they need help with, particularly with the medical needs. But on top of that, it also, actually, an illness also will bring them a lot of psychological and even spiritual needs as well, which we take time to actually address. Other than that, we also liaise together with hospital.
Right, I have to stop you here because, see, you're talking about it, it's all very systematic, the way you're talking about it. But I guess, did at any point of what you do, did it get to you? Did it psychologically get to you? Seeing people go through what they go through.
Okay. Yes. Yes. Especially when I first joined, in palliative care, when we have to face.
Did you go back and cry? And after seeing someone like that, caring for them, going back, nursing the feelings that you have inside.
Yes, we do. I do. Personally, I do. And sometimes I think even when I'm talking to my patients and even the family members there, sometimes I tears.
Yeah,
but
I can see your eyes welling up right now. What about you, Doc? What about you?
Yeah,
I know doctors can be very methodical about what they do. Sometimes they put feelings away, empathy aside, because they need to get a job done. Is this true?
I think we need to put ourselves into a neutral position.
Right.
A lot of time we doctor have to make decision together with the parents. If we ourselves like very down and like too much into our emotion, things become not so clear. So and we will use our emotion to judge a certain situation, especially for children that are facing the life and death issue.
Michael, do you want to jump in here?
Yeah.
Oh yes. My first contact with these children came about 5 years ago. Actually, we had this choir group whereby we do this caroling for the home of the aged, the less fortunate, and we actually visited the Selang Hospital at the palliative care ward, and that's where I came to meet Dr. Lee.
Right.
From there, I was quite inspired by the dedications of the people at the hospital looking after these palliative care patients.
Right.
And when the opportunity came for me to actually contribute my services to MAPPAC, that was 2 years ago, without any hesitation, I told them I want to do my little bit for the society.
Right. Well, if you're just joining us on the show, we're talking about World Palliative Day 2019, palliative care for our younger children or for the little ones. Now, can we quickly define what palliative care for kids or for children is about?
It's a concept. It's a concept that we call it total care. Not care only for the children, but also care for the full family. From the time that the child have been diagnosed that have an incurable disease until even the child has passed away, we continue to support the family. So it's not only the total itself, so including from the physical, the body, up to the emotions, spiritual, and into the whole social status of the child.
Okay. So looking at things holistically, let's just bounce this word around holistically. What is the longest time you had to spend on a child? I will not say patient because I don't like to use that word.
Okay. So for our visit, because we usually see them at home, sometimes it can range from between 30 minutes up to sometimes even 2 hours, depending on the need during that visit itself.
Right.
So
for how long do you do this?
Oh, okay. So
when you talk about palliative care, of course, it differs from one child to the other.
Yes, definitely.
Yeah, the longest you have worked.
The longest will be years.
Yes.
I would say. For kids, it's longer than adult. Because adult with the diagnosis is usually shorter. However, with kids diagnosis, their disease span is actually much longer. It could be up to years. Like at the moment, I think 2 years, 2-3 years.
So from a medical perspective, what is palliative care? What do you do as a doctor? You go there. What do you?
We mainly treat the suffering symptom from the pain, from the difficult breathing.
So you start with pain management first.
Pain management will be our usual business. And then go to their psychological their assessment and then supporting them. A lot of them go through the disease and then also they have a lot of emotion problem like depression, sadness, lost their hope. So not only the child but also the family. And importantly, we also wanted to give the family a break.
Right.
Give them a rest because a lot of the child have been 24 hours needed big care at the home, and some of the family not even have a time to go for shopping or buy something for themselves.
Right. Okay, Mike, I know your role in this is very on the administrative side, on how to ensure the sustainability all the time. But I'm sure you see gaps there, like when they intervene, when they go work with the family. Do you also help in that? You talk to the father or you listen? I think listening is a big part of of the job here. Just sitting down and listening to people.
agree with you.
It is an art form.
Yeah.
You see, I talk a lot. I don't listen. So, do you
You-
see
you-
yourself
you-
doing that?
Yes, you're right. In fact, as a volunteer,
You're right. I talk a lot.
as a volunteer, we have certain guidelines that was given to us, and this was basically we stem from the training that we received. Actually, we have just attended a 4 days program. And in fact, during the course of these 4 days programs, we were given guidelines on the way we approach the patients from a volunteer's perspective. And I think more importantly is that to have good listening skills, to be there for the patients is more important than anything else.
Yes.
As for the medical side of it, we leave it to the nurses and to Dr. Lee himself, because
Yeah, so I agree with Michael. A lot of time what they need is not the medical, it's
Yeah.
the human, the
Yeah.
care, the love from every one of us. That what they need.
Yeah, but when you do this for so many years, you of course, they say a lot of it depends on passion, but it becomes mechanical after a while. That love you're giving out is sort of, meted out in a way that, okay, I go see this person, I talk to him for a little bit, I spend 10 minutes talking to him, I spend 10 minutes checking him. It sort of becomes very formatted. How do you ensure that it doesn't become a part of a working system within you, but also ensuring that enough passion comes out? I don't know if I'm asking this question right, because it's a very tricky question here.
Maybe June can answer.
June,
that.
what you don't know, Angel? Maybe
Yeah,
June
you
can.
see now what they do. Okay, I'll start first. So actually,
No,
I think
I don't know if I got the question right. What I'm trying to say is, we do things so much all the time,
Yes.
we become mechanical.
I think what really matters to me is not just the passion, but it's also that I'm interested to know them, because I do see everyone is very different. So every time when I talk to a person, it's a whole new experience again. So I'm actually interested to know this person, to try to find out more, and that actually makes me want to listen more. It comes very naturally. I don't even have to, have a lot of task lists in my mind. It just flows. So, and that sense family often tell me that, when you come, you will actually touch the kid, you will play with them. All these gestures are very authentic. Are very genuine. So I guess this is what makes them feel, and this is what important.
Right, totally.
But sometimes we maybe lost the energy and capability to love. We are also human. We also have that
Burnout.
downside time. So when that happen, you need a teamwork. You need to step backward. Let your team member go on and support them from there, while you need the rest. And take your time and rest and look into yourself. And being someone who always loves someone is what the June says, trying to be understanding and trying to be there. But a lot of time, if we ourselves have our own problem, it's difficult for us to be there.
But it's also interesting that what he's saying, I'm sure will also resonate with you, because we as lay people will be watching this from on the foreground or in the background, and we come up with assumptions. Do you come up with assumptions?
Yeah, I think before I answer that, I remember I have actually asked Dr. Lee a question. I asked him, how do you sustain this, to be able to attend to the patients and on a very consistent level? And he mentioned one word to me. He said, Michael, mindfulness. Mindfulness in all that we do, the awareness that we have in ourselves, and constantly reflect on our encounters with the patients themselves. And for that, with that presence of mind, we should be able to overcome those type of, say, the emotional weaknesses sometimes. When you're so sad, your energy
so
is so
you
drained.
always need to see the bigger
Yes,
picture
picture.
all the time. Tell you what, well, there's a question that we are always asking ourselves. Now, in palliative care, does a child ask you about death? Well, we're going to find out when we come back right here at The Nation. Stay with us.
Brings you the latest in current affairs, lifestyle and entertainment, as well as one-on-one discussions with fascinating personalities.
Hello and thank you very much for staying with us right here on The Nation. This is Bernama. I'm Gerard Ratnam. We're currently talking about World Palliative Day 2019. And with me in the studio is Dr. Lee Chi Chan, a pediatrician, June, a nurse, and Michael Tan, who's a secretary to the Malaysian Association of Pediatric Palliative Care. Whew, that's a mouthful. MAPPAC. Now, we're talking about death, you know, I mean, just dealing with that, talking to a child. Have you ever encountered a child asking you, tell me about death?
We did, because actually that was.
I knew you were going to say you did, because I always wanted to know what a child says. You know.
Yeah, they come in can be any time. They can ask you anytime, and in the different way of asking. Sometimes they just say, they can ask directly, like adult, how long will I survive? But I'm glad when they ask that question, that means they come to the awareness that about what is they are going through, and also they are taking so much of courage to ask that question.
Okay,
it's not easy.
So sorry for interjecting here, but a child has asked you, how long do I have left?
Yeah.
How old is this child or was this child?
There are a few of them. Some of them are can be ranged from 6 years old to 18 years old.
Right. And June, what would you say? I'm sure, you know, you are looking after them, caring for them. I'm sure they'd also put that question to you. You know, if a child comes up to you and says, Miss June, how long do you think I'm going to live for? What do you say?
So usually I will try to find out what makes them ask that questions. You know, at this moment of time, there could be a reason or a trigger. Yeah, so to find out the reason behind, and then
I agree with June. A lot of time when they ask the question doesn't mean really what
You've
they want to answer.
You've been agreeing a lot with June, not like she must be doing a lot of work in the background. No, but
I really admire her.
Yeah, seriously.
I need to quote her words.
You need to. So we're going to make a book with quotes of June. But coming back again, now when a child asks about his or her death, or how long do they have to live, is it coming from the place of curiosity or fear, or both?
I think both, yeah.
Both.
Yeah, for example, if they're curious, they will like, when they see their other children have passed away in the same mode, sent into the ICU, never come back, they will wonder, even sometimes it's not their time to die, but they will ask those questions. Where will my friends go to? They want to know.
Right. So if you know, okay, and this is open to the three of you, anyone can jump in. If you know that this is coming from a place of fear, it needs to be addressed psychologically, because it's part of palliative care, it's part of pain management too, and fear brings about pain. We know this. Now, how do you deal with this? Michael,
I think let the doctor start first.
Okay, let the doctor start first.
I think when they come with a lot, we have to understand them why they are fear. A lot of time they are fear because of they're worried the separation more than exactly where they're going. They're separate from their family. They're worried they won't see their family anymore. They're worried whatever belonging, they will be being abandoned or being forgotten after many years. These are things that they're worried more than what actually where they're going.
Right, Anthony.
Yes, I think from my perspective as a volunteer, I remember there was one training session we attended. They played these button games, you know. Perhaps he might like to elaborate a little bit more. But the concept of this button game is that they play with the child using these various buttons. They ask the child to select the button, and from there, one question leads to another. And the questioning is not just only to find out the reason behind the feelings, the emotions of the child, but at the same time to be able to actually reach out, know exactly what's in the mind of the child. You know, you want to talk about
we always believe that a child is not a white paper. They come with a lot of experience, especially those cancer patients have gone through so much of things. They have so much of experience. Some of them even can tell their mom, I'm going to die after I drink this Coca-Cola.
Wow.
And exactly, it happened. Then they can sense that, they get ready for that. But the problem is in our culture that it's like a big elephant in the room. Nobody want to talk about it.
Right.
That's why we're trying to encourage people to talk about it.
So, if you have a piece of advice you'd like to give those of us who haven't yet encountered something like this, but who still stands a chance to encounter something like this with someone needing palliative care within your home, how do you deal with this? The talk about death, because I mean, all this care and all this pain management is leading to a good send-off. That's the way I see it. Okay. Now, for those of us who are not in the know and who may experience this at some time in our life, what would be your go-to advice for this?
I mean, we use a lot of tools to talk to them. Important is facilitate them to express how they feel about it.
Right. So if you're telling me now, if I say, Doc, I have someone in my family who's in stage something, what would you tell me first? And if I'm panicking, I don't know what to do.
We will ask how you feel about it. That's the first question. I want to know
how you feel about it.
Yeah.
So you need to find yourself first
Yeah.
before you can deal with that.
Yeah.
That's what he's saying.
Yeah.
Yes.
June,
Yes.
anything else to add to that?
Yeah, I guess it's like you have to know what's the main worries, what's causing you to be anxious.
Right.
Yeah, and of course there will be a lot of things that you have to deal with, but also the very important thing is whether that person is ready to have a discussion about it. Yeah, because sometimes they feel it, but they are not ready to talk about it. Hence, it's not actually our control to whether to start the conversations.
So it's World Palliative Month. Day was celebrated, or rather observed on the 12th. Throughout the month, what's happening? A lot of people come out at this time, rah, 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 promise something. World Health Organization says something.
Yeah.
Everyone goes, yes, we need to make it sustainable. But really, you, the people on the ground, know what's happening.
Yeah.
So, this year, as part of this chat that we're having, there must be a piece of advice you have for us or something you need us to know in order to move pediatric palliative care forward in Malaysia. Who would like to go first? Want to Zoom?
Yeah,
Okay,
I think
Michael.
I take this.
Yeah.
Okay. We will encourage people to come forward to serve these people, these special people, and coming forward is not just the monetary aspect of it, to be able to give their time, their effort, and commitment to the cause of this the children in palliative care, and it will be a lot of fulfillment not just within the as an individual, but I think for society too, and more so for the children out there, and when they receive this type of support from us,
Right.
you find that it is something that is just you just can't explain. The feel good factor that we give to them.
So you would say,
Yes.
go on, volunteer, and
Volunteer.
you will feel that
Yes.
come to you,
Yeah.
you'll feel that good vibe. We've got about 2 minutes left, maybe a little bit less. So we'll start with Doctor, and we'll end with the only thorn among the roses.
Okay. I was thinking we want to push this palliative care in Malaysia because it's very important. There are so many children are still suffering in our country. From the statistic, it shows that it's about 80,000 people in Malaysia need palliative care each year. And they are all living every part of the Malaysia. And but my problem is our public have no awareness, and our doctors are not trained to look into how to reduce their suffering. This is what we are working in a team from the NGO, from the government, from the community side, work hand in hand. That's the only way that we can make things faster.
Right. So we'll end with you, June. And this question, I want to put a question out to the government, to the opposition, to whomever or anyone that can come forward and help. Right. What would you want for the government or anyone in the position to help do for palliative care or pediatric palliative care?
I guess one thing is promotional campaign. See, we already going to come up with the national policy for pediatric palliative care. It's a guideline to actually guide the doctor how to work on that. So we'll be launching the book next year. Yeah.
Right.
So so we need more awareness.
You need more awareness, and you want
Campaign on
all of
that.
us. Bernama, RTM, everyone has
All the resources you
all
can
you
get.
guys better get involved. If not, June's going to come looking for you. Yeah.
We need that.
On that note, Dr. Lee, thank you very much.
Thank
Mr. Michael, it was a pleasure having you in the studios. And June, fantastic work you're doing.
Thank you.
We're here to pay tribute to World Palliative Care Day,
Yes.
or Pediatric Palliative Care to be exacting, and I hope something good comes out of this. On that note, we'd like to thank you once again for being on the show, and thank you for staying with us right here on Bernama. This has been The Nation. I'm Jared Ratnam, signing off. You have a great day ahead. Bye-bye.
Berita bisnes dalam dan luar negara. Ups, kisah jatuh bangun usahawan kecil dan sederhana. Bagaimana mengemudi bisnes dalam keadaan ekonomi yang semakin mencabar. Mulai 1 Oktober ini, anda boleh mendapat